I appreciate my colleague on the other side of the aisle and their sincerity and their desire to fix our healthcare system and make it better. I would suggest that Social Security and our healthcare system are not comparable or perhaps even analogous. Our healthcare system is $5 trillion. It's about 18% of our GDP. And Social Security does not have the same bloated cost structure that is inherent in a single-payer healthcare system, which our colleagues on the other side of the aisle have been ultimately proposing. And I think we need to think a little bit more deeply about ways that we can bring those costs down rather than bringing in, I think, incomparable and unanalogous other government programs. But with that said, I do think that there's a lot of bipartisanship in healthcare, and I think that there's a lot of things that we would agree on. Ms. Tripoli, thank you for being here, and thank you for your testimony. I believe in your testimony you urge policymakers to get to the root causes of high and irrational prices in our healthcare system. Is that correct? Yes. And you would agree that healthcare consolidation is one of the main drivers of high prices for patients?
Yes.
I certainly agree. And you also mentioned price disclosure, that hospitals should disclose the rates that they charge openly in dollars and cents, I believe were your words. Is that right?
Absolutely, yes. Price transparency.
I certainly agree. You also mentioned site neutrality, that we ought to prohibit health systems from charging Medicare more for the same procedure if it's done in a hospital versus a doctor's office. Is that right?
Yes.
Well, those are I think are all things that we can agree on, which is really nice to hear. So I appreciate that. Mr. Jacobs, I want to ask you about Obamacare. Obamacare was sold to the American people as a program that would drive down premiums. I think the number that was thrown out by President Obama at the time was $2,500. Has that promise come to fruition?
No, it has not, Congressman. And premiums on individual health insurance policies on the marketplaces and the exchanges more than doubled in the law's first 4 years, and that's primarily because of the regulatory mandates that the law imposed. And premiums have continued to increase substantially, and they continue to increase substantially more so on the exchanges than for employer-sponsored coverage.
So you would say that Obamacare didn't slow the growth of premiums in any meaningful way?
I think, if anything, quite the contrary. I mean, Senator Welch, I believe, last month admitted on the Senate floor that the law failed to reduce costs. But more than that, I think it's accelerated the cost growth because of the consolidation that has come about in terms of hospital mergers, insurers buying PBMs, et cetera, et cetera.
Mm-hmm. And that's what I was getting to. Did Obamacare address or fix any issues related to price transparency?
Ultimately, there have been regulatory efforts. Some of the Trump administration efforts were actually linked to regulatory requirements in the law, but I think we can and should do more. And I think we've also seen that hospitals aren't necessarily complying with that law either willingly or easily.
Did Obamacare address or fix issues related to pricing disclosure?
I think we need to do more, is what I would say.
Got it. And it's your testimony as well, if I heard you correctly, that Obamacare actually exacerbated pricing issues related to healthcare consolidation.
That's correct, and we've seen that in many areas. For instance, the Congressional Budget Office recently released a report on the 340B program and how the 340B program encourages increasing federal spending and consolidation. Now, Obamacare did not create the program, the 340B program, but it certainly dramatically expanded it, and is one of the reasons why it's continues to grow and continues to accelerate health costs.
Got it. And there's with the remaining 30 seconds, as you know, there's a lot of debate right now about potentially extending COVID-era enhanced premium tax credits. In your opinion, would that lower overall health care costs, or would it raise overall health care costs?
The subsidy regime is inherently inflationary because once an individual hits their income in terms of how it's structured in the law, the percentage of income, every marginal dollar of a premium increase gets paid by the federal government. So insurers have no incentive to control costs because whether the premium goes up by 1% or 100%, the feds subsidize that. And so it's an inherently inflationary structure. We've seen the concerns about fraud. I think those reasons, coupled with the fact that enrollments have held steady thus far in open enrollment, all suggest that we should allow the enhanced subsidies to expire.